Hello, hello, and welcome to this edition on the Hindu Wellness webinar on awareness about vascular ailments. The webinar is presented by Kauvery Hospitals on the eve of Vascular Surgery Day, observed annually on August 6th. There are 60,000 miles of blood vessels, including the arteries, veins, and lymphatic vessels, running through our body, carrying oxygen and nutrients and helping to remove waste from our tissues. When these blood vessels are affected due to plaque made of fat and cholesterol, it spells trouble as the blood flow gets blocked. Any condition that affects our circulatory system leads to a baffling range of vascular ailments and can be dangerous for the heart, the brain, and all other vital organs. Doctors say lifestyle changes can help, but people may also require medication or surgery. For today's webinar, we have three vascular surgeons from Kauvery Group of Hospitals who are experts on blood vessels and in their daily job help scores of patients manage vascular diseases, provide treatments that help prevent stroke and aneurysm ruptures. They assist in complications in other areas of surgical specialties. Working with complex anatomy and highly skilled at solving various medical problems, we are privileged to have one of the senior most vascular surgeons in the country, Dr. N. Shekhar. He is like a surgeon's surgeon and currently working as the chief vascular and endoscopic surgeon at Kauvery Hospital in Chennai. After completing MBBS from JIPMER, Pondicherry, and MS in General Surgery from PG Institute of Medical Education and Research, Chandigarh, Dr. Shekhar became the first medico in the country to get MCH qualification in vascular surgery from Madras Medical College. Recipient of multiple fellowships, Dr. Shekhar is known to be the first surgeon who started endovascular surgery in Tamil Nadu. Given his expertise in peripheral arterial disease, diabetic foot care, varicose veins, stroke prevention surgery, deep vein thrombosis, dialysis access surgery, renal transplantation, majority of practicing vascular surgeons in Tamil Nadu today are his students. Dr. Shekhar has to his credit one of the largest number of limb salvage for diabetic patients in the country. In his talk here today, he will focus on vascular diseases and surgery, diabetes and prevention of amputation. A very warm welcome to you, Dr. Shekhar, and the floor is yours.
Thank you so much. And I'm indeed grateful to the Hindu group as well as the Kauvery Hospital for giving me this opportunity. Today we have, this has been arranged to commemorate this Vascular Awareness Day. This is the day we started our Vascular Society way back in 1994 on August 6th at Chennai, and when I was the organizing secretary. To create an awareness about vascular surgery, which is still abysmally low. And what happens is, because of that, a lot of unnecessary amputations are done throughout the country. So globally, it is said that every 2 minutes, someone is getting an amputation done. And majority of these amputations are done for either diabetes or trauma. And there are a few very startling statistics you must remember, that gangrene, which is the death of tissue, is 50 times more common in diabetic men and nearly 70 times more in women. Normally, women are protected from many diseases because of the hormones. This is one where there is gender parity. And nearly 35 to 50% of all lower limb amputations done because of diabetes. And in diabetic care, 25% of the patients who get inpatient care is due to foot complications. The first being due to control of diabetes, next is foot complication. Any patient, diabetic patient who develops a foot ulcer gets an immediate worry. Is he going to lose the leg? That's the panic reaction of every patient, which is understandable. India has 101 million diabetics, which is expected to increase further. And nearly 6 to 7% of them develop vascular blocks. It's a huge number considering our population. And Indian population is aging. Our average life expectancy is nearly 70 years now. So age is also another provoking factor. And smoking is on the rise amongst various groups of people. So smoking, diabetes, and age are the three important causes for developing vascular blocks. So a huge increase in number of vascular complications is expected. But unfortunately, there are not enough vascular surgeons, and awareness about the vascular diseases is very, very low. So that is why we are taking an effort to reach out to everybody to and create through various forums trying to talk about vascular diseases. See, up to 85% of the lower limb amputations in diabetes are preceded by a foot ulcer. That is, initially you develop a foot ulcer which is not treated properly and keeps on spreading, and unnecessary stupid surgeries are done, and then the infection spreads, and ultimately they lose the entire leg. So that can be avoided if you treat them, catch them at that point and treat them properly. And the other important factor you must remember is the risk of developing arterial block increases with the number of years of diabetes. So somebody may be only 40 years of age, but if that person has been having diabetes for 20 years, he will develop all diseases that are seen in a 60 or 70-year-old man. So 40% of the patients who are diabetic for 20 years will develop PVD. And the other important is, even if the diabetes is well under control, you will still go on to develop arterial block, which is a little bit unfortunate, because patients do ask, my diabetes is absolutely under control, I'm very strict, why am I developing this? It is something which you cannot stop completely, but there are certain ways you can prevent complication and using the leg. Most important message of this lecture is this, that many limbs are lost because of minor surgeries done on ischemic limbs. Because patients do have some corn, small toe abscess, some ingrowing toenail, and promptly somebody goes around making an incision, removing that corn or removing that nail. What happens is arterial block, which is underlying, which had been remaining quiet, starts producing trouble now. And then infection doesn't heal, and the ulcer starts spreading, and they end up losing the leg. This is the most important thing. Without checking vascularity, no kind of surgery, including minor, should be done on the leg of any diabetic patient. So if all the doctors follow this rule, we would be avoiding a large number of amputations. Because every patient who comes to us has already had some kind of a surgery which is not healing and it is spreading, and then they are referred to us, which is unfortunate. See, what happens in diabetes? What you get is an atherosclerosis, which is something like a fatty substance and some calcium which gets deposited. So you can see here the artery slowly becomes narrower and the lumen gets blocked, and ultimately sudden block also can happen sometimes. So it depends on which part of the vessel is getting affected. Anything going to the heart will produce heart attack. The artery going to the brain will produce stroke. Artery going to the leg will produce leg attack, what we call as gangrene or peripheral vascular disease. So there are certain types of presentations. In fact, I didn't want to produce too many gruesome pictures, so I have chosen some of the milder ones. You can see an ulcer in the foot which is excavating, not healing, no sign of granulation. Granulation means it should be red, nothing there. You should be beware of even deep-seated heel ulcers, which are very painful. The underlying vascularity problem, they will go on to develop an ischemia. It is very easy after this is a late sign when the patient has already developed a gangrene, and the patient many times the presence like this. So initially they will complain of pain in the leg on walking, and some injury will produce an ulcer, and which does not heal. Then the pain shifts to the ulcer, and they start developing something called a rest pain, and the color change of the toes happens. Some patients who are having neuropathy will not have so much pain, but they will have numbness. And what do we do in these cases? We do non-invasively Doppler scan or a CT angiogram. You CT angiogram, you see here, it shows the blood vessel. There has to be 3 blood vessels below the knee. So this is a knee area, this is the foot. And you see there are only 1 vessel, and even that is showing block. The other 2 are missing. Even the other leg, you see multiple areas of blocks, and the other 1 more artery is missing. So this kind of multi-level disease is very common. And for these, how do we manage? A patient who comes without tissue loss, that is no ulcer, only claudication, pain, there we can manage. So the important cause is tobacco in any form, whether it is smoking or chewing or pan parak or whatever it is. You must stop tobacco in any form, because tobacco and diabetes together, they cause blocks in the blood vessels. And the next is keep walking. So our slogan is stop smoking and keep walking. majority of the time, you can avoid developing arterial blocks. And the next important thing is foot care. So many people walk barefoot and get into injuries and stuff like that. And a proper footwear. These two are also very, very important. We put them on some blood thinner drugs, so which will help in promoting blood flow. Then cholesterol lowering drugs, because they will remove the cholesterol and make the plaque thinner, and control of other comorbidities like diabetes, hypertension, obesity, heart failure, and all those things. If you control proper diet, all these things will help towards improving the blood flow. See, blood is like a demand and supply. If you demand more, the heart will supply more. And so if you walk, it helps in improving the blood flow. It helps the heart, helps the leg, also helps to lower the blood sugar. See, not all cases are, respond only to medical treatment. When the thing becomes worse, then we go ahead and do see, you see here in this, block has come and the blood flow is stopped and the toe becomes black. So this is the situation that happens. It can happen anywhere in the body. And you see here, this is a bypass that has been done. See, simply there is a block, and from the above area which is normal, a tube is connected to the area below which is normal. So this is a bypass operation, just like a road principle. And the bypass, we normally use the vein that is available in the body. If where the vein is not available, we use artificial things. Nowadays, the number of bypasses have come down, and we are doing that minimal access surgery, that is the endovascular surgery. Here we pass a wire and a balloon is distended on that, and the block and the plaque or a block which has been causing the obstruction is stretched and compressed, and the artery, the lumen is re-established. So this kind of a procedure is a balloon angioplasty, the same thing what is done in the heart. So that also can be done safely, and patient recovers faster. But there are certain limitations that bypass operation is longer lasting, whereas this endovascular procedures are shorter acting. You may have to repeat the procedure after some time, because here we are not removing the block causing plaque, that is atherosclerotic material we are not removing, we are only compressing it. Sometimes when you remove the balloon, the artery collapses. So to prevent that, we put a stent, like you see here, a metal which keeps the artery open in these cases. So now minimally invasive procedures are given as a treatment of choice in many of these patients. Kauvery has been at the forefront of preventing amputation. We do around 75 open surgeries and around 150 endovascular procedures for limb salvage every year. So nearly 225 to 250 limb salvages we do every year. We also perform 25 to 30 stroke prevention surgeries, which will avoid stroke, which I think Arunagiri will be talking about. This is the next most important message. That is 35 to 50% of diabetic people who undergo major amputation on one leg develop significant disease on the other leg within 1 to 2 years. So what will you do if you amputated the first leg? Will you amputate the next leg also? So amputation is devastating for the family, both economically, mentally, and the whole family will be on the road. So you must make any effort, all effort to avoid an amputation. That is why we take so much. And there are certain simple instructions, what should be done, what should not do for the diabetic people. They should inspect the foot every day, wash them in tepid water, apply moisturizer. These things prevent cracks through which the infection goes in. Proper footwear, MCR, MCP, silicone insole. Whenever you have to go to the temple, you don't go walk barefoot. There are silicone socks available, which will prevent your sole from getting burnt. Take care of nails and regular walking. These are very, very important for a diabetic. On what should they not do? Walk barefoot, smoke or use tobacco. Many people have the habit of dipping the leg in hot water. That's the worst thing to do. It will produce burns and get into trouble. And performing bathroom surgery, that plucking out the corns and nails and things like that, don't do any such thing. And wearing new shoe for more than 2 hours at a time, because shoe bite is another common cause for these things. See, this is one of the message which he gave 20, 30 years ago. Tevai suya pada puja. Worship your own foot. You don't have to do it for a God man. Worship your own foot. You will live long and you will live healthy. So save your foot, keep walking for a safety and healthy living. Thank you so much. I just gave you a bird's eye view of the vascular problems in diabetics and how to avoid it.
Thank you, sir. That was really very beautifully explained in simple terms. We'll now move on to our next speaker, Dr. Arunagiri Viruthagiri, vascular surgeon from Trichy. A medical graduate of Kilpop Medical College, he too, like Dr. Shekhar, completed his MS in general surgery from PG Institute of Medical Education and Research and MCH in vascular surgery from Madras Medical College. With a decade's experience of working in India and the United Kingdom, Dr. Arunagiri specializes in peripheral angioplasty, lower limb high pains, vascular repair and trauma, aneurysm repair, amputations, and much more. With his interest in limb salvage in diabetic foot ulcer, thrombolysis in DVT, and minimally invasive endovascular intervention in peripheral arterial disease, Dr. Arunagiri, who was instrumental in setting up Department of Vascular and Endovascular Sciences in Tamil Nadu Multi-Super Speciality Hospital, Omandurar, now dreams of establishing a center of excellence for vascular diseases in Trichy that would offer 24/7 vascular service and training opportunities. He also wishes to set up a world-class limb salvage center. His presentation is on varicose veins, stroke prevention for carotid diseases, and arteriovenous access for chronic kidney disease. Over to you, Dr. Arunagiri.
Good morning, everyone. Thank you, Mrs. Soma Basu, for your kind introduction. At the outset, I would like to thank the Hindu group and the Kauvery Hospital management for organizing this awareness on vascular diseases on the eve of the National Vascular Day. As it has been mentioned, this is the first time we are organizing a walkathon across 26 cities across the country. And the theme has been an amputation-free India. As alluded by Professor Shekhar sir about the numbers of amputation being performed in India and across the world, it's a significant setback to the family for a person to undergo an amputation. And the sad part is many of these amputations are preventable if detected early and addressed in a proper manner. Now, moving on to my topic of varicose veins. So at the outset, what are varicose veins? Before that, I would like to talk what are veins. Arteries are the blood vessels that take oxygenated blood to the tissues, to any organ, including the brain. Even the heart requires an artery and a vein. So any organ, extremities, they all require oxygenated blood, and arteries are the blood vessels that transport the oxygenated blood. Veins take the blood from the organs back to the heart once the oxygen is consumed. In other words, they carry the deoxygenated blood. Veins, especially in the extremities, in the upper limb and lower limb, they are a one-way system. They do have valves. Valves act as a gate to prevent the blood flowing in the reverse direction. So varicose veins are dilated, tortuous, and elongated veins, as you can see in this picture, where the veins are bigger than normal. They are tortuous, they are not normal, and they stretch, which is what we call it as elongated. So who all can develop varicose veins, especially people who have a long-standing job? They'll have to stand for a long period of time. The most common occupational group are the chefs who work in hotels, police personnel, farmers, surgeons. We surgeons, when we have to stand up for 6 to 7 hours, a long period of time, pregnant women are more prone to develop varicose veins because of the increased hormone levels. Symptoms: with varicose veins, people can develop pain. The pain is very characteristic. When they wake up in the morning after sleeping, they feel fresh. At the end of the day, after a long day standing, they feel an aching or a heaviness in their calf. That's very classical of pain due to varicose veins. Then over a period of time, they tend to develop swelling of the legs. They develop discoloration around their ankle as shown in this picture, and they develop itching once it advances a bit further, and at the end stage they develop an ulcer. They develop an ulcer is a break in the skin. So here with varicose veins, there is a problem in the veins, but the target organ is the skin. The skin of the lower limb is the target organ, which can manifest in these manners. In some patients, they do present with bleeding because of the increased pressure in the veins. As I mentioned earlier, what happens with a reversal of the flow is the pressure in the vein increases. The normal pressure in the veins is somewhere between 10 to 20 when you stand. Whereas in people with varicose veins, the pressure goes up to 100 or 120, which is very high. And there are a few people who also present with cosmetic concerns, where they can see these veins dilated and spreading all over their thighs and legs. So once they present with varicose veins with these symptoms and signs, what do? We do a simple test called a Doppler scan. It's a very inexpensive, non-invasive test which can be done in 10 minutes. For majority of the varicose veins, this single test alone can determine whether we need to do treatment, and if at all we need to do treatment, which vein do we need to address. So this helps in confirming varicose veins and help us in guiding the further treatment. So coming to the treatment perspectives of varicose veins, not all require treatment. If we take, for example, if we treat about 100 varicose veins, there are another 200 people with varicose veins. We don't offer a treatment. Spider veins are thread veins. They look like a spider in the thigh, in the posterior aspect or the anterior aspect. They do not require a treatment unless they cause bleeding or they are cosmetically disfiguring. And people who present with asymptomatic varicose veins, they just have dilated veins, they don't have any symptoms, they can wait. There is no urgency in addressing those asymptomatic varicose veins. The majority of people whom we treat are those with symptoms and signs, which include involving the skin changes, as I've mentioned earlier. So they are the group who need treatment, who present with pain, swelling, discoloration, or ulcer in the legs. So coming to the treatment options, how do we treat varicose veins? Traditionally, it was treated by open surgery. In open surgery, what we used to do is disconnect the vein at the point where it joins into the deep vein and strip or remove that entire vein. But now, for the past decade or so, what we do now is a procedure called laser ablation. In the picture on the right, you can see me introducing the laser fiber. You can see the red light, and that's essentially the hole through which we treat varicose veins. So there are hardly any cuts or scars. And in laser, the mechanism is the blood which refluxes through the vein. So what we do by laser is we occlude the vein in which the blood is refluxing. So the blood cannot reflux anymore, and it is rerouted to the heart in the way it should normally run, thereby preventing further complications. And in people who have ulcers, that helps in healing of the ulcers. So what are the advantages of these minimally invasive treatment? Like the laser procedure is, they have lesser hospital stay. They get admitted in the morning, they go home the same day or the following day. There's early return to work. Most of the people whom we operate return to work within 3 days. They are very effective in ulcer healing, about 98% effectiveness in ulcer healing, and they have an extremely low recurrence of varicosities. What do I mean by recurrences? The same problem coming again. So the recurrence rates with laser ablation is about 5%. And the laser, people tend to think any new technology you have to take with a pinch of salt. But the thing with laser ablation is it's been in practice for 2 decades with proven success. There are good quality evidence to suggest that 1, it is effective. Number 2, it has a very low recurrence rate. So we have enough data to show that it is very useful and effective. There are, I would like to clarify certain myths commonly prevailing in the community. The first thing, whenever we treat, recently treated a 32-year-old man who's been having a non-healing ulcer for 5 years. After treating for varicose veins, within a week, the ulcer healed. So he was profoundly thankful. The thing is, he had a very innocuous, simple problem which could have been addressed earlier, preventing stigma in his workplace, improved his quality of life. But he was told that varicose veins are due to blockages in blood vessels, and never ever operate on varicose veins because they will invariably or definitely recur. This is what the prevailing message gets circulated in the community. Now, through these webinars and similar meetings through the IMA, we do create awareness among the practicing clinicians and the public about the truths and break the myths. So to summarize my talk today on varicose veins, it's a very common problem. There are clear indications for treatment. It does come with a very simple solution with proven results. My next topic is regarding stroke prevention. As we all know, stroke is a significant health problem in India as well as across the world. So what is stroke? In simple terms, there is sudden interruption of blood flow to the brain. So in stroke, there are two types of stroke. One is called an ischemic stroke, where there is lack of blood flow. And the other one is called a hemorrhagic stroke, where there is bleeding inside the brain, thereby causing stroke. The ischemic stroke or strokes due to lack of blood flow are more common, accounting for nearly 85 to 90%. The hemorrhagic stroke is lesser common, about 10 to 15%. So today in my talk, I'll be addressing on ischemic strokes. So who are the population at risk? People who have diabetes, who have hypertension, who have increased cholesterol levels, who smoke, who have coronary artery disease, who have peripheral arterial disease. As mentioned by Shekhar sir, they have blockages in the leg arteries. Because what we need to understand is a blockage in the leg or in the heart, it's a systemic problem. It does not happen in one place. It happens across the body. It does manifest in one place upfront. It could manifest subsequently unless we address the risk factors, which is why addressing the risk factors are of paramount importance to prevent vascular events in other territories. So what is transient ischemic attack, which is called, so there is a sudden transient weakness of one side of the body, transient slurring of speech, transient blurring of vision, and all these recover within 24 hours. They are very short-lived. So this we call in simple terms as a mini stroke. And then is the stroke, where you have a full-blown weakness of the arms or legs, slurring of speech, facial drooping, loss of consciousness, which lasts longer than 24 hours, and it does take a variable time to recover. So what's the role of a vascular surgeon in a stroke? Stroke is traditionally, it needs to be treated by the neurologist team. But what we need to understand is whenever a stroke happens, what are the sources of stroke? So the most important question is, from where did the stroke happen? What is the reason for the stroke to happen? And this slide would explain that. So the source of a stroke to happen comes from the heart in 30% of individuals. In 30% of individuals, there is a blockage in the blood vessels in the neck that supply the brain. And in another 30%, the block is inside the brain. So where, as vascular surgeons, we come into play is in the middle part, where there is blockages in the neck vessels. So what needs to be done when a person develops a stroke? They need evaluation of their heart, because there can be a problem in the heart where the heart can beat irregularly and throw a clot to your brain. Unless you pick that up, you are going to have another stroke, or the heart could throw up another clot to your arms or legs. So it's very important after a stroke to get checked your heart. You need a Doppler scan within 48 hours to check the blood flow in the vessels in the neck. And then, of course, you need an imaging of the brain. So even though you develop a stroke, which involves the brain, you need evaluation of your heart and blood vessels in your neck to prevent further problems. So after evaluation, if there is a problem in the heart, they will need blood thinners to prevent recurrent strokes. If there is a problem in the neck vessels, they will also need blood thinners. But there are a small group of patients where if the blockage is more than 60% in the neck, blood thinners are not going to dissolve those blocks. In such cases, we perform a procedure called carotid end arterectomy, which means, as you can see the picture on the right, we remove the plaque inside the blood vessel. So what you can see in the picture is actually taken from the blood vessel supplying the brain, in which platelets, cells, they form clumps and they throw to the brain to cause stroke. Unless we address this, they are prone to get recurrent strokes. And of course, as I've told you earlier, the most important thing about vascular disease is it's a systemic problem. So once you develop a vascular event, you develop an MI, you develop a stroke, you develop a leg attack, you develop a problem to your gut, you need lifestyle modifications. And these modifications are the one which will prevent further events. So you need to maintain a healthy diet, maintain physical activity for 45 minutes every day, avoidance of smoking or alcohol, good sleep. Sleep is currently in this generation, I think sleep is grossly neglected. You definitely need 7 to 8 hours of good sleep every day. You need good control of diabetes, in which you need your HbA1c less than 7. I'm sure people are aware about HbA1c. That's a marker to show your glycemic control over 3 months. And you need good control of blood pressure and compliance to medications and regular checkup. For want of time, I'm just skipping on the arteriovenous axis. Briefly, to mention what arteriovenous axis in chronic kidney disease is, people who develop chronic kidney disease, at some point of time when it gets worse, they need dialysis. So dialysis is a method to support your kidneys temporarily. It's not a solution. People should not misunderstand that after doing dialysis, the kidney will become normal. That happens in a small proportion of patients. So as vascular surgeons, we create an arteriovenous fistula in the arms to aid in dialysis. Again, these arteriovenous axes, they do not replace the kidneys. They help in dialysis and prevent them from having a catheter in the neck, which can get infected. So, there are a large volume of kidney disease patients. In an ideal society, before they need dialysis, at least 6 months before, they would require an arteriovenous access. With that, I thank Mr. Soma Basu, I thank Shekhar sir and my colleague Dr. Karthikeyan for joining in this webinar. I'm sure people would be educated on various topics about vascular diseases. And I would like to mention finally that no act of kindness, no matter how small, is ever wasted. Thank you one and all for your patient listening.
Thank you, Dr. Arunagiri. Though scary, but yeah, you did share a lot of valuable inputs and a lot of takeaways from your presentation. We'll now move on to our final speaker for the webinar, Dr. S. Karthikeyan. He's the consultant vascular and endovascular surgeon from Salem. He's experienced in managing complex vascular diseases and saving the limbs of patients by doing angioplasty and leg bypass surgery. Dr. Karthikeyan has special interest in diabetic foot ulcers and is also known for open surgery and laser ablation for varicose veins, dialysis access surgeries, aortic and stroke prevention surgery. Dr. Karthikeyan will speak on aneurysms, acute limb ischemia, and vascular trauma. Welcome, Dr. Karthikeyan.
Good morning, one and all. Thank you, Ms. Soma, for the introduction. And I thank Kauvery Hospitals and Hindu for giving this platform to show about what is vascular ailments and also about awareness creation. So moving on to my topic, today I'm going to speak about aneurysms acute limb ischemia and vascular injuries in trauma, meaning an accident or any other falls injuries. So what is an aneurysm? Aneurysm is Am I audible?
Yes, sir.
Yeah. Aneurysm is a ballooning of the blood vessel. It can happen in any part of the body. So it's a weak spot, and as it enlarges, it can pop like a balloon some point in time. And the significant part of this is the individual is devoid of any symptoms, and when he gets symptoms, he is in the stage of the aneurysm starting to give away, and it's going to burst. So it becomes like a catastrophic event. And these are detected during routine tests for ailments, which is done for any other purposes. So the difference between knowing the aneurysm beforehand and in the last moment is 80%, more than 80% of the individuals die of an ruptured aneurysm, and 50% don't reach the hospital at all. So it's quite essential that we know about it and we monitor it and take precautions from preventing it from bursting. Can I move on?
Yes, please.
Okay. So as I said, because of this catastrophic event and a high mortality rate, it is essential to diagnose and keep those individuals on our routine screening and treat them at the appropriate moment, because all aneurysms don't burst.
Dr.
And,
Karthikeyan, if I can interrupt, your slides are not visible.
okay, let me check with the AV team.
Yeah. In between, we just got a flash. Yes, we can. Yeah, it's there now.
Okay, slides are visible now. Thank you.
Yes.
So, to know about the incidence in India, it is quite low or underreported, is just 0.4%. But given the population we are dealing with, the numbers would be quite high. And overall prevalence in the Asian population is 1.3%, and there is a higher amount of incidence in the Western population. The UK has a robust screening and monitoring system, and their impact on the society is due to rupture, they lose 12,000 individuals per year. So this is the magnitude of the problem. And with more diagnostics and more awareness, the incidence in our population is also on the rise. So this is quite something that can change the scenario within a day or within hours if the patient develops a rupture in the aneurysm. And the other issue we are dealing with is this is another catastrophic event. We call it acute limb ischemia, wherein there is a sudden decrease or blockage of the blood vessel, and the blood doesn't go on into that particular blood vessel. This is similar to a heart attack. In heart attack, the heart does not get blood supply and they develop symptoms. And similarly, when a leg or a arm does not get blood supply, there is no oxygen flowing into the muscles and the tissues in that particular arm, and that could cause catastrophic situation for the individual, meaning this can result in what we call it as gangrene or requiring amputation. This is one important aspect where we have to save the limb, and it is a dire emergency. And leg pain or a hand pain can happen to anyone, and many of our colleagues also see individuals and treat them. So most important thing to see is, as I showed in the picture, if the patient has a pain in the arm or the leg, and then clinically we are not able to feel the pulse, and they don't have sensation in that particular leg or arm, and the arm becomes cold, they are unable to move the fingers or the entire leg. These are important symptoms for an acute limb ischemia, meaning the sudden stoppage of blood flow into that particular limb. And this can happen due to all the risk factors, as Shekhar said had mentioned: age, atherosclerosis, diabetes, smoking, and high cholesterol. The clot can happen in that particular blood vessel or get showered from the heart or any other blood vessel which is above the particular limb involved. So we call it atheroembolism. It just showers and causes such things. It could happen even to the intestines and cause symptoms of the particular organ involved. And this requires immediate treatment in the form of open surgery or endovascular treatment. We use blood thinning substances, we call it lysis, or anticoagulation if the blockage or the decrease in the blood supply is to the extent that we can manage just with blood thinning itself. And another catastrophic thing is road traffic accidents or any other injuries during a fall, which can cause blockage of blood supply to the involved limb. So as I showed in the picture, this is quite a common event, a motorcycle getting hit with any other vehicle, or kids or even elders playing and they fall down and develop a fracture.
Dr. Karthikeyan, we are not able to hear you. Am I audible?
Save that particular. And this chart, a pie chart, is taken from our Ministry of Road Transport's data in 21, and we can see that there is 30% incidence of grievous injuries. We don't have data on the limbs lost due to such accidents. So there is 30%, about 30% of the people who have non-injuries or minor injuries, we are not worried about that, and about 30% have fatal events. This 30% is quite important because this 30% may have associated limb injuries and loss of blood supply to that particular involved limb. So promptly assessing it can help save that leg. And how, as vascular surgeons, we get involved in such events is, this is any patient seen by other specialists or colleagues. If they have a suspicion, or if it's a polytrauma, we call it injuries at multiple places, and any involved limb has to have at least an arterial Doppler scan. So this picks up any injuries to the blood vessels, or it picks up the flow, and this is a screening process, and we can go on to treat if there is any involvement to the blood vessels. With this, I conclude my speech and thank everyone for the opportunity. As my previous speaker said, Dr. Arunagiri, rest well, eat smart, and performing age-appropriate exercises. These are most important preventive factors for vascular diseases. Thank you.
Thank you, Dr. Karthikeyan. I think with the three very exhaustive presentations, we are almost nearing the completion of our program time. But I would quickly like to first ask Dr. Shekhar, because, you know, there are a lot of common symptoms and overlapping treatment protocols. So I just wanted to understand, who takes this onus? How does a patient, since we are trying to create awareness, how does a patient know that this is a vascular surgeon's case and I should go to a vascular surgeon?
Yeah, that's actually a good question. It is impossible for a patient to know whether they have a vascular problem or not. It's imperative that the doctor to whom the patient first goes should know, should be able to pick it up. This is why, in fact, we are concentrating also on the general surgeons as well as the general practitioners to pick up these vascular problems early, because they are the ones who are going to see the patient first. They are not going to come to the specialist immediately. So that is the reason why we are conducting this awareness itself. The sad thing is only 20 medical colleges in India have vascular surgery department. And out of that, nearly 10 of them are in Tamil Nadu. So you can imagine what will be happening outside the state of Tamil Nadu. So they have to know whenever a patient, that's why we said blanket, any diabetic patient who has got a foot problem must have a vascular assessment before you put your knife on the patient. Majority of the amputations will be solved, will be prevented if that simple precaution is taken. Unlike the patient, that's why we are talking about for the patient, if they develop pain in the leg on walking, that means there is something wrong with the blood supply. So patients who smoke, who are hypertensive, who are diabetic, who develop this kind of a simple symptom must check somebody, consult somebody. And if you go to a diabetologist, they do a set of tests, which includes a simple Doppler study of checking the blood flow in the leg. Every diabetic should have a basic preliminary blood test as well as this Doppler test to make sure that the leg is okay and the blood supply is okay.
But then the worry is also, as you pointed out, there are only 20 medical colleges in the country which have vascular surgeons, and of them 10 are in Tamil Nadu. So what about the other states then? I mean, where do they get the vascular surgeons for their treatment?
There are people in private sector, but everybody can't afford a private sector. No,
Yeah.
Why we are insisting is it must be there in every government-run medical college so that it is available free. So there is a lot of difference between medical care in Tamil Nadu and elsewhere.
Right.
That is the problem.
And how expensive are these surgeries, if at all a patient requires a surgery? Maybe Dr. Arunagiri, you could take that.
Yeah.
How expensive, to that question, it depends upon what procedure is being offered. There's no fixed rate or fixed package for it depends upon whether people get treated for varicose veins or whether they undergo a bypass, whether they undergo an angioplasty stenting. Even in an angioplasty stenting, it depends upon how many places does the blockage have, whether he actually needs a stent or doesn't need a stent. If at all he needs a stent, is it in one place or two places? So on an average, generally in a private sector, for people who have blockages in their arteries, who undergo bypass or angioplasty, for angioplasty somewhere it will be around 2 lakhs. For a bypass procedures, I think it will be somewhere close to 3.5 to 4 lakhs would be the estimated cost. Again, these are very variable. There are a lot of patient factors and individual characteristics. How long is not everybody is the same. So I'm just giving you a rough idea.
Right. Dr. Karthikeyan, since you touched upon aneurysm ruptures, so Raghunandan Ramachandran is asking, are people born with aneurysm? Is it congenital?
I mean, the aneurysms are a chronic event that happens in the blood vessels, and there is a genetic basis to it, but they don't get aneurysm at birth. There are some reasons where they develop aneurysms in younger age. We call it connective tissue diseases that happens in their probably in their teens or early 30s. But as a whole, aneurysms happen in the 5th or 6th decade, or sometimes even 7th decade. It's purely a degeneration of the blood vessel, and it happens over time. It could happen in many parts as well. or in only one part of the blood vessel.
Do this also occur outside? Like, does the vein even rupture and is there a kind of a fountain of blood coming out? Is all internal bleeding?
Yes. So the aneurysms in the blood vessels, in the arteries, are deeper structures, and it's always an internal bleed. So we don't see them obviously. They don't like burst like a fountain. So everything, as I said, even before they reach the hospital, they may not be able to sustain it. And that's the gravity of situations if these are unnoticed or they're not diagnosed. And um, once we diagnose, we don't treat them straight away. We keep them on our routine screening or monitoring depending on the size of the aneurysm. There is a risk-benefit ratio between treating them at one particular size, and that's about 5.5 centimeters. After which, the risks of rupture go high. So that's how we titrate the treatment protocol for each patient. Sometimes the aneurysm may not grow at all. They might outlive the aneurysm's growth. So we are just trying to reduce the risk of the patient's life, which is caused by the rupture in the aneurysm. So, and different aneurysms, different parts of the body are treated at different sizes. So this is serial monitoring, probably every 6 months or every year, depending on the size and also the site where we pick it up, and treat them at the appropriate time.
Dr. Shekhar, as you mentioned that, people generally tend to overlook long-term diabetes, and they are the ones who also have higher chances of vascular disease. So, I mean, maybe it's a little bit of a repetition, but how would one recognize a vascular block?
Yeah, see, that's like I said, it's a very simple thing. Do not ignore your leg pain. I mean, occasional pain, you've done extra walking and the leg is paining, that is okay. But every time you walk, if you're going to develop pain, that means something is wrong. So you must investigate that. And like I said before, every diabetic must have a periodic checkup of blood vessels at least once a year. If you go to a diabetologist, they do a set of tests which includes this Doppler. So that will pick up. See, they measure the pressure of in the blood pressure in the ankle level and compare it with the pressure in the arm. Normally, the ankle pressure will be equivalent to or slightly more than the brachial pressure, upper limb pressure. So if that starts dropping, that means you have started developing blood vessel block. That even before you develop symptoms, you can pick it up like that. But most important thing is patients should be aware that symptom of pain, inability to walk the usual distance. The classical symptom will be, they say, I walk 200 feet or walk for 10 minutes, then the leg pain comes, I stop, the pain goes, and then again I'm able to walk the same kind of distance, which is typical of blood vessel block, which is not able to supply blood to the calf muscle, which is working more because of your walking, and it needs more oxygen. So that is how they should pick it up. And any ulcer which does not heal, if they have an ulcer, it doesn't heal. So many times it could be neuropathic ulcer, that is where there is no sensation and the ulcer doesn't heal. They are a different group, but the ischemic ulcers are different. They come and they kind of heal a little bit and they break again and it becomes very painful. They are different. So they should be able to pick it up.
So is it possible to diffuse arterial blockage in the lower limb? Like, can it be managed at home?
Yeah. That is, unless it causes, we are not going to operate on every patient. So we need to make sure that the vessel doesn't go for a higher level of blockage. We cannot prevent it, but with medication, it can be slowed down. So that is why this antiplatelet drugs, they are the blood thinners, which is the platelet is the most important thing which triggers this block from developing. So we block the platelets by giving this blood thinners, then this cholesterol medicines, and then regular exercises. Like I said, it's a demand and supply. You have to put that artery to demand or the muscle to demand then the artery will open up and supply more blood. If somebody just does not walk at all, automatically the blood vessels shrink for the amount of blood that is required for a resting muscle. The artery will not give excess blood supply when there is no demand. When you demand, it will open up and give more supply. So that is why you have to keep on demanding. That demand is done by walking. If you don't walk, you are in serious trouble.
Like Dr. Arunagiri, you mentioned briefly about menopausal women maybe being more prone to varicose veins. So likewise, somebody's asking, is there gender variation in each of these things that we have discussed, in each of these topics that we have discussed? And what are the preventions?
So if I get the question right, is there a gender variation among the diseases, among
yes.
all the topics we've discussed today?
Yes.
So there is, with regards to the first one, peripheral arterial disease, it's more prevalent in men compared to women. The reason being more smokers in the male population. That's one. And even among the diabetic group, the majority of patients whom we see with blocked arteries, we see more male patients. The proportion would be out of 100 patients whom we see, 80 to 85 would be males, about 10 to 15% would be females.
I think it is because women are not being looked after.
Right. So a related question, Dr. Arunagiri. Anita Ramasamy is asking that I have varicose veins and have had 2 laser surgeries done in past 7 years. So does she stand a chance? I mean, will it recur again? She's worried. She's worried.
So if she's had 2 laser surgery, if she is currently asymptomatic, then it is fine. If she's asking about will it recur again, there is a possibility. The chance of recurrence is about 5 to 10%. 90% of the time, the recurrence, it won't recur. And the thing with varicose veins is what people get carried away is by the appearance of a few veins here and there. We, as treating physicians, we try to educate people that a few veins seen here and there, they need not be very concerned about it, apart from cosmetic concern. The actual problem in varicose veins is just not the ones which are seen outside, but the veins which we can't see inside, where the actual problem lies. So as long as what is being treated by laser remains treated, doesn't reopen again, it does not transform into a new clinical problem. So in simple words, the chance of recurrence is 5 to 10%. And more than the appearance of veins, if she starts to develop symptoms or signs like swelling, itching, then she should be concerned and she should consult a vascular surgeon.
Sounder Rajan PM is asking, what is the role of Daflon? So anybody can take this question. Role of Daflon.
Daflon is a venotropic drug. That is, it makes the vein shrink and empty the vein so that the congestion is removed. Thereby, it is symptomatic relief. It's not a cure, but it does relieve the symptom. Let me just add, making it simpler about the previous question. See, recurrences will happen, but not all recurrences require intervention. That is the answer. That is, you will have some minor veins here and there. As long as they are not causing trouble, we need not worry. We have to worry only when the vein that has been treated by laser or radiofrequency ablation reopens. That can happen in around 5 to 10% of the time. That time they will go back to the kind of symptoms which they had earlier. So one, we have to rule out any problem in the abdomen, the vein above that point, whether there is a problem which is causing the vein to reopen. Otherwise, we need not worry at all about this local point. That is why we never advise surgery for the sake of cosmesis. That is totally different. We only treat symptomatic veins. Okay, and even if these small veins come, we can always manage them with some injections to block them, and no need for a repeat surgery.
Actually, we've already run out of time, so I would quickly would like to wind up because we are again trying to emphasize on awareness about vascular disease and like diabetes and smoking, they're all common risk factors across many diseases, and people do know about it. So, but still, people tend to be callous about their lifestyle. So as doctors, like on the eve of Vascular Surgery Day, I would like each of you to wrap up your messages and also reiterating this year's message, which is making India amputation free. So maybe we could start with Dr. Sekar.
Yeah. So to conclude, all diabetic patients must keep their diabetes under control and keep walking, and please look out for the symptoms in the leg, whether there are any leg pain, small ulcers, anything like that coming. You must look after your feet. You must wear proper footwear and inspect the foot, maybe apply some moisturizer, make sure there are no ulcers or anything like that. And you should have a periodic checkup of the vascular status of your leg at least once a year, just to make sure you don't miss the bus. There's no point in doing something after the event. So we should try and prevent it. Still, it is preventable as long as you take these basic precautions. And smoking is absolutely no, or tobacco in any form should not be used. If you can do that, you can save your legs and live normally.
Dr. Arunagiri, before you give your message, there's one quick question about, if somebody has acute varicose, then how long the patient can stand? Like, you said standing for long hours is not really advisable. But if an acute varicose patient wants to know what exercises she can do and how long is she allowed to stand?
There's no terminology called an acute varicose veins.
Okay.
So probably they would have noticed varicose veins very recently, is what I gather from their question. It's most of our jobs need some form of standing. So it's very difficult to say that refrain from standing at all. What we advise is, if you are in a standing job, take some breaks in between rather than continuous standing. If you have to stand for 2 hours, take a 10-minute or a 15-minute break. And if this new onset of varicose veins is concerning you significantly, do consult your nearby vascular surgeon, is what I would advise. There's no need for refraining from standing, and there's no fixed duration. It depends upon your work, your nature of job. The only thing we would advise for people with varicose veins is you can continue to stand, but do take breaks in between. Just sit, stretch your legs, take a break, so that it relieves the pressure on the veins.
Stockings.
And stockings at work.
And since you also mentioned pregnant women, so there are a couple of questions they worry about varicose during pregnancy.
So varicose veins during pregnancy, regarding that, it's it is very common for developing varicose veins during pregnancy. They need not panic, they need not worry. Hardly ever we treat varicose veins during pregnancy, and most of the time, once the hormonal influence subsides, when they finish lactation by 6 months or 9 months.
There's some disturbance from Dr. Karthik and your end.
Yeah, I also wanted to add to the prevention part, maintaining a good lifestyle, and even BMI, we call it, height and the weight, if they are maintained. The symptoms of varicose veins can also be postponed, or we can minimize the symptoms. So that's another important factor, particularly in the mid 40s to 50s. We are bound to get varicose veins because of the various hours of we standing, and all professions. Anywhere we go, we keep standing and or sitting with the leg on a chair. So it's imperative that we have a good lifestyle and check our weights and monitor it so that we can avoid symptoms.
So other than trauma injuries, are children or adolescents in any way affected by varicose veins or any other vascular disease?
Children and adolescents are generally, they don't get affected by vascular diseases. Generally, vascular disease is a disease of middle or elderly age group, apart from varicose veins. Varicose veins we do see in younger people in between 20 to 30. Again, as Shekhar sir was mentioning, we don't treat varicose veins for cosmetic concerns. We try to reassure them over a period of time, things will settle down. Unless they develop symptoms or signs due to varicose veins, we don't push them to get treated. We just have to spend some time, reassure them that it is a bit prominent, it won't concern you. And in the event they develop any skin changes like discoloration or itching or pain, we do advise them to get treated.
Dr. Shekhar, I think you wanted to say something. I saw you raise your hand.
Yeah, about this.
Yeah.
Yeah. In children and adolescents, we have a different set of diseases, vascular disease, like congenital disorders, like AV communications and things like that. They can also present as varicose vein. They are a totally different disease, and they need a different type of treatment. They are very highly specialized and a little bit rare. So, primary varicose vein requiring surgery, yeah, they do occur in adolescents. Normally, these people would have a strong family history of varicose vein in them. And some of them do require surgery, not that all of them can be managed medically. So if they are symptomatic and involving the main vein, there is a strong reflux, they may require surgery. But they have the congenital ones are totally a different set of diseases.
And what about senior citizens? I mean, who often complain about cramps. So are they in any way related to
No, as you grow older, you will develop varicose vein in the number of the incidence of varicose vein increases with age. By then, see, because of age, the valve becomes weak and it becomes incompetent. Like it is said, it is like a one-way traffic. The blood has to go from below up, not come from above down. Everything is controlled by a set of valves. When this valve gets weak, it allows the blood to come back. So these veins, unless they are causing symptom and trouble, we don't advise surgery in these people. They will have visible veins. If they cause little congestion, that heaviness and the crampy feeling and things like that, advise them to wear stockings and they will do very well. Stockings, intermittent leg elevation, and keep pumping your foot. That is moving the foot up and down. This is like a peripheral heart, what we call as peripheral heart. This actually stimulates the cough muscle to work, and the cough muscle squeezes the blood and pushes the blood back. Just like you have a good heart for the good blood, the cough muscle is the one which pushes the blood back. We call it the peripheral heart. So anybody who does not move the cough muscle will develop swelling in the leg as well as varicose. So the older people, that is the cause.
Okay, Dr. Arunagiri, we'll quickly go back to you for the wrap-up.
My wrap-up message today on the Vascular Awareness Eve is, I think with varicose veins, just by its appearance, you need not get concerned. But when you do have symptoms and signs, as I've mentioned with in the leg, do consult a vascular surgeon and get treated appropriately. It is, as I mentioned, it is a very simple problem, common problem, with a simple solution and proven results. With regards to stroke prevention, my message is, once you develop a stroke, do get evaluated for the reason of stroke. Once you get evaluated for the reason of stroke, we can prevent subsequent strokes or subsequent vascular events. Thank you again.
Dr. Karthikeyan?
Okay, as a wrap up, I would like to this is a very crude way. Any injury or any ulcer in the leg, as vascular surgeons, we deal more issues with the leg than with the arms. So any ulcer, it doesn't heal for more than 2 weeks after giving appropriate treatment. It could be any treatment. So that could be either due to varicose veins or due to arterial, like blood supply getting affected and not healing. So anyone with an ulcer more than 2 weeks may take will benefit with a vascular assessment. It could be veins or it could be arterial diseases, and we can diagnose them earlier and then treat them promptly.
Okay. Thank you very much. There are, I think, a few more questions which are left unanswered. If any of you wishes to take it, you could answer them directly. And I thank once again Dr. Shekhar, Dr. Arunagiri, and Dr. Karthikeyan for sparing your time and joining today for the Hindu Wellness webinar on awareness about vascular ailments. It was presented by Kauvery Hospitals on the eve of Vascular Surgery Day, observed annually on August 6th. Thank you all very much.
Thank you so much.
Thank you. Thank you.